So MGTA-145 is a novel agent, which is a CXCR2 agonist. In preclinical studies and in healthy volunteers, it has shown promising activity for same-day stem cell mobilization, especially in combination with Plerixafor. And so we investigated this new regimen of MGTA-145 and Plerixafor for same-day stem cell mobilization in myeloma. Now, typically what happens for mobilization is that patients will get several days of GCSF injection, typically 4 days, and on the 5th day after GCSF, they start apheresis. And apheresis can be anywhere from 1 to 4 days. So this makes this process over a week long. What this combination can allow is to shrink this into 2 days. And so there is no need for multiple days of GCSF. Patients would come in the morning, get Plerixafor, and 2 hours later will get MGTA-145 infusion, and then within 30 minutes start apheresis on the same day. And in this study, they would come back for a second day if they collected less than 6 million CD34 positive cells per kg. So that was the study design. At the ASCO meeting and at EHA meeting, we are presenting preliminary results on the first 15 patients. And what we found was that this is a highly effective regimen. These 15 patients were a representative sample of patients with transplant-eligible myeloma. About 70% had received VRD therapy, 30% had received DARA-VRD therapy, and about 20% had received 2 lines of therapy before moving to stem cell mobilization. It could also be patients with impaired renal function in this study. And we found that this combination was well tolerated. We only saw grade 1 treatment emergent adverse effects. And the most common one was transient pain that happened soon after MGTA-145 and lasted for about 5 minutes and went away without any intervention. In terms of efficacy, 100% of patients collected enough cells to proceed with transplant in 1 or 2 days. 90% patients collected more than 2 million CD34 positive cells per kg in 1 day. So in terms of additional stem cell collection, over 80% patients collected more than 4 million CD34 positive cells per kg, and over 50% patients collected more than 6 million CD34 positive cells per kg. So what does this mean? This means that in this preliminary study results, we found that this regimen is very efficacious and is a novel way of collecting stem cells, which can improve the patient experience. No need for multiple days of stem cell mobilization, as patients often have to move away from their home to come to a transplant center. This saves time away from home. It can help improve resource utilization by compressing the time needed for collection. And importantly, it can also decrease some of the side effects associated with GCSF-based mobilization, which mainly includes bone pain for many patients. So this study is ongoing, and we hope to complete this study this year.